October is Breast Cancer Awareness Month, and so today our guest is Dr. Ben Smith from Essentia Health, and we're going to talk a little bit about breast cancer and how Essentia Health can help folks with breast cancer and mammograms. But I want to talk first, maybe, Dr. Smith, about how prevalent breast cancer really is.
Yeah, so most people aren't aware of how prevalent breast cancer is. 1 in 8 women in a lifetime is diagnosed with breast cancer. So at some point in your life, you're going to either be related to someone or know someone who's been diagnosed and hopefully cured of their breast cancer.
Yeah, I feel like we all know somebody who's experienced cancer in one form or another, and breast cancer is certainly prevalent. What are some of the options people have to detect breast cancer or even maybe to prevent breast cancer?
That's a good question. Unfortunately, there's not a lot we can do to prevent breast cancer, so it really comes down to early detection. The things we can do to prevent breast cancer are kind of those things we always do to stay healthy. Maintain a normal body weight, exercise, eat healthy, drink less or not at all. Those are things that have been shown to slightly decrease the risk of breast cancer. Unfortunately, breast cancer is just common, and there's a lot we can't do to prevent it. And so that's where screening for breast cancer comes in. And screening for breast cancer is done with mammography. And so at Essentia Health and really throughout all of breast imaging, per the American College of Radiology guidelines, we recommend a mammogram starting at age 40 every year for women.
And describe that process. Growing up, my grandmother had breast cancer. It was pretty important for my mom to get the regular mammograms and probably some additional things. And, certainly I don't know what that experience is like. What is that experience like for a woman to schedule that mammogram and then actually to go through that?
Yeah, so most people aren't aware you don't need a physician's order to have a mammogram. You can essentially walk in off the street and get your mammogram. But a lot of people do their mammogram in conjunction with their kind of annual physical. And so we do mammograms every day, well, almost every day, maybe not Sunday, but all year long. Women come in for the mammogram. It's a pretty quick visit. They come in, change, and have 2 pictures taken of each breast, and then they're on their way.
So you get those pictures taken, and do they go home and just kind of wonder, or what's the next step if you find something or you don't find something?
That's a great question. So typically the same day, perhaps a day later, if you have your mammogram done at Essentia in Detroit Lakes, I read the mammogram images or I look at the pictures and generate a report. And I usually do that either the same day or within 1 or 2 days. Subsequently, a letter is sent out to every patient that's had a mammogram with the results. Now, if there's something unusual on the mammogram or something we need to look at further, one of my great technologists will contact patients, and this comes up not infrequently. And so, it's I know very nerve-wracking for most women to get called back for some extra pictures or an ultrasound or something like that. But most of the time, the funny shadows that we see on mammogram turn out to be nothing to worry about. But of course, we do all that to find breast cancers when they're very small and very early and very, very curable.
Sure. Well, let's talk about curing breast cancer. You get a mammogram over at Essentia Health. You take a look at those pictures, and maybe you see something, and you make that phone call, and they come back. For a lot of people, getting a diagnosis, hey, you've got breast cancer, that's got to be pretty overwhelming for someone. But there is some good news catching breast cancer that early, isn't there?
Absolutely. We do, we want to do mammograms to catch breast cancers early. When we can catch a breast cancer confined to the breast, that means not spread to the lymph nodes or anywhere else in the body, the cure rate for breast cancer currently is 99%. So when a breast cancer is confined to the breast, the cure rate or 5-year survival is 99%. That's kind of what we measure all cancer statistics in, is 5-year survival. And so that's the incentive to get your yearly mammogram, is to if we unfortunately catch a breast cancer, we catch it when it's small and very, very, very treatable and curable.
And when we talk about residents of the Lakes area, one of the nice things about Essentia Health right here in Detroit Lakes is you have all of that equipment and certainly the staff to be able to do mammograms and to read a lot of that stuff, correct?
We do. Yeah, we've got a great team here at Essentia Health. We've got all the equipment. I trained down at the Mayo Clinic where there's world-class equipment, and we're fortunate to have that same equipment here in Detroit Lakes. We have a 3D mammogram unit. We've got state-of-the-art ultrasound. We've got breast MRI. We've got all the tools we need to diagnose breast cancer.
And certainly October, we spent a little bit more time talking about breast health and things like that, but Essentia Health is certainly committed to women's health and breast health all year long. If someone's looking to schedule a mammogram or get in touch maybe with a provider for specific women's needs, pretty easy to do that, correct?
Absolutely. You can just call the Essentia Health number. If you call the general number and ask for a mammogram, you can get one scheduled, like I said, without a doctor's appointment. Or if you want to set up a primary care appointment and schedule a mammogram, it's very, very easy.
Sure. That's Dr. Ben Smith with Essentia Health. Thank you so much for your time today.
Thank you. Appreciate it.